Hello, I'm Jessica Perez, Community Relations Manager at Legacy Community Health. Ultrasound technology is a valuable tool in caring for our OBGYN patients.
And I'm Dr. Erin Beltramini, Gyn Physician at Legacy. Today, I'll be answering questions about ultrasounds and how they are used in monitoring pregnancies, as well as questions on pregnancy-related issues.
What is ultrasound?
I'm glad you asked that. Ultrasound is energy in the form of sound waves. During an ultrasound exam, a transducer sends sound waves through the body. Those sound waves come into contact with tissues, body fluids, and bone. They bounce off and are sent back like echoes towards the transducer. The transducer then receives these echoes, which are turned into images, and then those images can then be viewed as pictures on a video monitor. Ultrasound scans, sonography, or ultrasonography is a popular method of getting exact images of internal body parts and any development or abnormality in those body areas.
How is ultrasound used in OBGYN care?
Ultrasound is best known for its use in monitoring pregnancy, but it can also be used to monitor other medical conditions not related to pregnancy. First, we'll talk about some of the obstetric uses. Obstetric ultrasounds used during the different stages of pregnancy are helpful in determining the due date, the baby's weight, its position, and even the gender. At least one ultrasound is standard during your pregnancy and is usually performed at 18 to 22 weeks to check your baby's overall development. This is commonly known as your anatomy ultrasound. Ultrasounds can detect possible health problems in your baby, including Down syndrome, spina bifida, or anencephaly. Or they may be able to find other problems such as congenital heart defects, cleft lip or palate, club feet, or gastrointestinal and kidney problems. Early detection of these problems can then be further evaluated by a specialist. In addition to checking for overall development and screening for birth defects, ultrasounds are also used to monitor for a baby's day-to-day well-being, or in times when a patient may feel that their baby isn't moving as frequently as usual. This is done by checking the baby's heartbeat, muscle tone, movement, breathing, and the amount of amniotic fluid.
What is a condition that is often identified through the use of ultrasound?
Placenta previa is a common condition in pregnancy that is detected through an ultrasound. It happens when the placenta lies very low in the uterus and covers all or part of the cervix. The cervix is the opening to the uterus that sits at the top of the vagina. This is where the baby must pass through during birth. Placenta previa is diagnosed either during a routine second trimester ultrasound appointment or after an episode of vaginal bleeding. Most cases of placenta previa are diagnosed at the time of your anatomy ultrasound around 20 weeks. If you have placenta previa in early pregnancy, it usually improves by the third trimester. Routine follow-up ultrasounds are scheduled until the placenta previa has resolved. However, if it does not resolve by late in the third trimester, it can cause severe bleeding during labor and birth, which can put you and your baby at risk.
How does Legacy Community Health utilize ultrasounds in treating its OBGYN patients?
At Legacy, pregnant patients have access to routine ultrasounds and genetic testing to provide critical information regarding the health of your baby. Pelvic ultrasounds can also be ordered for pelvic pain, irregular or abnormal bleeding, or pelvic masses like fibroids or ovarian cysts. Talk to your Legacy Community Health OBGYN provider about the best treatment for your overall OBGYN care or for that of your pregnancy. Call Legacy to schedule an appointment today.
That is all for today. I'm Jessica Perez.
And I'm Dr. Beltramini. Thanks for joining us and have a wonderful day.